So smart rehab, so smart device, everybody is talking smart. Is your device smart? Is your cart smart? Is your house smart? Smart house, smart this, smart that. So I think everybody is getting smart except the human being. I think all of us are becoming dodos. That's what I think. Honestly, I'm not joking. Think about it. As a child, the number of phone numbers I remembered was terrific. I would remember so many phone numbers. Today, I don't remember two people's phone number. The third person I have to think. In fact, my own car number I don't remember sometimes. Is it MD or MS? I've changed the car. I have to get down and see what's going on. This brain has become so decadent today because we are not giving it enough work because everything is being stored by somebody else. But now, what is smart rehab? See, today what was happening was a couple of things. Number one was that the brain is such a complex organ. It does so much of functions. See, I'll give you some of the words that we neurosurgeons and neurologists use. We talk about aphasia. We talk about apraxia, we talk about alexia, we talk about agraphia, we talk about acalculia, we talk about hemiparesis, we talk about proprioception. If I talk this language to a lay person, it's impossible for them to even understand what the hell is going on. It will only psych them up further. So what was happening was all these are technical parts of the different systems, different circuits in the body, in the nervous system. But I had to make them understand in a language that they understand. Now, thanks to the smartphone and the smart devices available, it's become ubiquitous. One is the device availability. Second one is the appification of the phone, which is the YouTubes and the Facebooks and the WhatsApp and the TikToks and all of that's happening. So I decided the simplest way, and the Wi-Fi and the upload and the download, I thought is the simplest way to communicate a complex problem, dysfunction, function of the brain is in the way of a smart device. So when I start telling them this, what's your operating system? I ask people. The moment you ask the phone, I said, is it iOS or is it Android? That's a common question people say. I said, what's your operating system? Is it iOS? Is it Android? The one upstairs. Nobody knows. So who gives the iOS? Who upgrades it? Usually it's who loads the information is either the parents or the grandparents. That's what happens in the beginning, and then the friends and colleagues and everybody else who gives the updates, what is going to happen. That's the reality at the end of the day. So now I realize that smartphone, if some patients think as you're talking, they take few minutes to answer. That means the upload and the download is slow. That means the system is slow. The system, so we know what a system slow means. There's either rubbish in the system, too much of memory usage, whatever. So or the Wi-Fi is slow, or the language, it's the software is old. You need an upgrade to a later version, whatever. So when I'm using these kind of terms, people start relating to it. Number one. Number two, when I use complex medical jargon, they get depressed. They think I've got a cancer or something like that. But when I start relating it from the IT industry, so smart device, even those who are suffering have a wry smile on their face. Oh, correct, sir. So upload problem again. They understand what, because it's like the disc, the colored disc that keeps going when the upload is happening and things like that. So, sir, ಸ್ವಲ್ಪ upload, so people slow, but sir, notice, sir, ಸ್ವಲ್ಪ. They come like that. So it's very nice for us to, to be able to communicate, and non-intrusively and without making them feel bad, and yet give them energy and, make them feel better about it. Next, the other way I communicate, you see, brushing, eating, dressing, bathing, handling the mobile, all of that is a set of tasks that the patient has to do, or a skill that he has to have. So I converted all of them into an app. Brushing is an app. In brushing app, work agtala, correct, doctor? So app sari mabidi, doctor. They sort of able to relate to that. But this started one day when I was actually invited, it was going on in my brain, but it sort of got more clearer when engineering, I don't know which organ, NASCOM, I don't know who invited me to talk. It was an AR/VR conference. And in the middle of this AR/VR conference, they called me to talk. They said, you're doing something, we heard about it, please come and talk. So I had to talk something different. I'm a brain surgeon going into an AR/VR conference. So I started my talk by telling everybody. I said, I come from the original IT industry. And everybody looked at me like, no, what is this guy? What's this smart guy? I said, I come from the central nervous system, which is the original IT industry. All of you guys are a pale copy of that. This is the truth. Because you can't, I can retrain the brain, you guys can't do that. And then I started telling them about AR, VR, ML, deep learning and AI, and they use all sorts of terms. I said, let me start with the first phrase that what I work with called RR. which is real reality. Then I showed a patient whose hand is troubling like this, and I did a surgery, boom, it stopped. So I tell everybody, I'm a brain circuit surgeon. So the problem is here, I fixed it here. So it's an upstairs problem, not a downstairs problem. Same way with the guitar, his problem was here, but I fixed it here. So everything eventually goes upstairs to know what is going on. And if I can do that, that becomes a big thing. So I realized that one, I had to make my system smart. The smart has its own expansion. Smart is specialized. M is measurable methodologies. A is analytics, assessments, and AI. R is rehabilitations. T is techniques and technologies. So that's the acronym for SMART. It's not just SMART. So we are using it both ways. In fact, all the brain maps, so all of us are maps in the brain. Moment we've got a skill, like you see if you are driving. After initial driving, when you get into the car, you said, good God, I have 2 hands, 2 legs, and 5 things to deal with. How is that possible? And then after some time, you are driving so casually at the end of the day, you don't even know which pedal you pressed, which gear you changed, and things like that, because the brain has gone into auto mode. So that's called a subconscious or non-conscious way of learning. So once that happens, your brain is now free to do something else. So that happens with practice, and that is what is most important by building brain maps in the brain. So I'm calling them brain maps, M-A-P-P-S. Apps with the M in between, brain maps. So it's a nice way and a very non-personalized, impersonalized way of communicating, a suffering to a patient, so that it doesn't disempower them, but it empowers them to take action.